So there's a really a wide range of impacts of atopic dermatitis on the patient. There's a component where we understand that direct impacts on sleep disturbance and daytime fatigue, which is directly related to both the itch and the skin pain. That in of itself can have a number of indirect effects in terms of absenteeism, presenteeism, workplace productivity, etc., impact on job performance. In the pediatric realm, and even within the adult realm, there's an impact on education and leading to potentially poor qualifications, impacting career trajectory and financial problems. There's also a component of mental health symptoms, and that's probably multifactorial related to both the sleep disruption and the itch, but may even have other components driving it. But we see symptoms of depression, anxiety, low self-esteem. There's even associations with chronic headaches that have been shown, and then even potentially suicidality across different studies. And then there's that impact that happens on activities of daily living and really just the entire aspect of what patients might like to do in terms of poor tolerance for heat, as an example, or challenges with clothing, etc., which can impact family time, can impact daily activities, etc., limiting business trips, a variety of different impacts. The hallmark of atopic dermatitis is the itch. Consequently, the impact that itch has on sleep, on those other downstream manifestations. These are data from a study, a multi-center study that examined the burden of atopic dermatitis in a treated population, and found that, not surprisingly, the more severe the disease in that moderate to severe patient population, that there's a higher average intensity of itch. There is a greater frequency of itch that happens, more patients reporting really that persistent itch throughout the day. And then, of course, that sleep disturbance as well, being more prominent as well in moderate to severe disease. There is a cumulative impact that happens on patients' lives in terms of quality of life impairment. And again, these are data from that same multi-center study that showed that really even in mild patients, you can see considerable impacts in terms of quality of life, limitations in terms of clothing worn, limitations in terms of social and leisure activities, work, study, even just shopping and gardening activities, which are all different domains of the Dermatology Life Quality Index. But as expected, with more severe disease, you have an even stronger impact on those aspects than in the patients with mild disease. And, interestingly enough, those patients with more severe disease actually having, on average, a higher proportion with lower household or lower family income, which suggesting that this may be impacting, income generation because of those cumulative effects. Now, how does atopic dermatitis compare with other inflammatory disorders? We're certainly very familiar with psoriasis. This is one that has gained a lot of attention over the past decade. And actually, it appears that atopic dermatitis is at least as bad as psoriasis, and from some studies may even be worse in terms of its work productivity impacts and activity impairment. So these are data from a U.S. population-based study that examined work productivity and activity impairment in patients with atopic dermatitis, and found that, not surprisingly, higher rates of absenteeism, higher rates of presenteeism. So even when they're able to go to work, there's a loss of work productivity, overall work impairment issues, and activity impairment. And, we would expect that, of course, compared to healthy controls. But what was fascinating was when they compared it to those patients with psoriasis, you actually had similar impacts as psoriasis. And in some respects, in the case particularly of absenteeism, it looks like there's even a higher impact, although not statistically significant, but overall really a very similar burden to psoriasis. And so we see that, in fact, atopic dermatitis is really a highly burdensome disorder comparable to some of our worst disorders.